best, especially for one of those milestone events like a wedding, class reunion, or big birthday. Who are you going to call? The Wrinkle Busters. Please welcome from the Institute of Anti-Aging, Dr. Richard Leconis, and Clinic Director, Dana Leconis. Hello. All right, we mentioned at the top of the show how we can now live to 120 years old. So that's what's going on the inside. But we also now can improve how we look on the outside.
Yeah, absolutely. I mean, all of us would like to be 120. We just don't want to feel 120, act 120, or look like we're 120.
Yeah.
Well, figure that part out. But yeah, we try to do things that help keep your skin rejuvenated and new, and keep the repair processes in active function, so that you won't look
like 120. Yeah.
Exactly.
All right, and Dana, you all travel around the world to find the best, latest things to use, and there are just some things that just work.
Yeah, we do, and when you're getting ready for an event, it's important to plan. So start thinking about it about a month, 2 to 4 weeks ahead of time.
Yeah.
Because we can do Botox like 2 weeks before, light chemical pills a couple weeks before.
Yeah, some things can be immediate,
fillers.
other things need a little time to settle
right.
in.
And then we have day of the wedding or day of the reunion type procedures like the hydrofacial, but we have a combination, a variety of things that we can use.
All right, well, the Leconis have a patient who has a big event coming up, so she went to the Institute of Anti-Aging.
I'm Patty, and I'm going to Paris for my 65th birthday. So I want to have some of these areas smoothed and fixed. I've got the wrinkles here. I've got around the eyes. You know, there's a lot of texture that needs some work after 65 years.
All right, well, Patty has already had some work done, but she still wants a little bit more, so she's getting it right now. So come on up here, Patty. Come on up. Look, okay, I want this to be my 65, okay? You are sassy. You don't have time to slow down.
No.
You're going to Paris.
Going to Paris, not Texas.
Yes. All right. So, Patty, do you remember the first time you looked in the mirror and said, oh, I don't like that, and there was something you could do about it besides surgery?
You know, it's been about 5 years, and I said, something's got to give. So, you know, because your forehead, around the eyes, the lips, there's just no other way you can do anything about it.
Right. So, and of course, before it used to be that we had to do surgery.
You know, I think good skin care and keeping your skin looking beautiful and young is a program.
Yeah.
It's not something you just start to do, you know, day after tomorrow. So the earlier you start, we've talked so many times about, you know, sunscreens and things, but rejuvenating skin agents that help you know, signal the healing processes in your skin, and then obviously things we can do like Botox, like fillers to.
All right, let's start with Botox. And, of course, Dana, Botox, you know, it's funny. It's one of those things that we think everybody's heard of it by now, but people ignore that information until they find it in the mirror and look one day and go, what is that stuff again? What is
exactly
right? So Botox for her. And your thing is that you have done so many of these, you train other people how to do it. You're conservative at it.
Very conservative, and Botox is so safe. It's a purified protein, the most studied medication in the world, I believe, and it's good, strong safety record. I'm just going to do a little bit around her eyes. She still has some crow's feet, so I'm just going to do a light injection. Squint for me. So we're going to take these little crow's feet away.
Yeah. And so
tiny. This hurts less than a Texas mosquito bite.
Okay, good. And then, of course, we can see the difference, you know, sometimes in a few days, sometimes a couple of weeks. But what it does, that kind of before and after, is that when she smiles in a couple of weeks, you're not going to see those crow's feet appear there on the side.
It relaxes those muscles that create those lines of facial expression that, you know, we call wrinkles.
Yeah. Do we have the before and after?
There you go.
Shots here? Okay, so there you go. You can do that in the forehead, you can do that in the side of the eyes, and so there you go. That is going away. Okay, at the same time that we stop some things from having wrinkle problems, we have other things that we call fillers.
Right. Yeah, that would be like Juvederm, which is hyaluronan. It's the same stuff that your skin naturally makes as a plumping agent. And so as you age, we lose hyaluronan in our skin, which creates kind of a deflation effect. Wrinkles.
Yeah.
So the idea is that we kind of re-inflate.
So look like they're under the eyes where you lose volume there sometimes.
We plump the skin up and it takes up the space. It's kind of like my old analogy, grape to the raisin, you know. Once it's beautiful, smooth grape, then as it loses volume, it gets a little wrinkles in it, so you revolumize it.
Yeah, and you know what I noticed there too is that she had a natural eye lift there. Is that
Yes,
the Botox or is that the
exactly.
filler that did that, Dana?
That's the Botox. Once you relax these muscles that are pulling down, it allows like your brows to elevate. So it gives a nice little arch, and we can, if it's too much, we can put like a little Botox just to relax it. But that's what a lot of patients really enjoy.
And also right around the lips, you kind of get those smoker's lines, whether you've been a smoker or not, but it kind of draws in.
Yeah, pursed lips maneuver. So when you're speaking, some people purse their lips a lot, and they get that what looks like smoker lines, even if they've never had a cigarette in their life. So, the Botox works well around the lips too.
All right, when people come in, they can get kind of a whole skin profile chart. What do you go through those checkpoints? Because you don't only look at what you see, for face value right there, but you can also tell what's coming, what's on the way.
Yes, we can do a VISIA skin analysis to see the UV damage, the damage from the sun. We can put the patients on a plan, tell them if they need Botox, fillers, lasers. So we'll give a full evaluation and a plan, a treatment plan.
There are also some topical things that you can't find, over the counter necessarily. You have to be sold in a doctor's office, and usually that means because it's potent enough to work.
Exactly. These are medical grade nutraceuticals that you can, and that's what I talk about, a program. So the earlier you start something like that, the more results you're going to see, but it's still never too late to start.
Yeah. And what's that you have in your hand there?
This is one of the best products. I know that this is TNS from Skin Medica. And this basically has what we were talking about earlier, tissue regeneration and tissue rejuvenation factors. These are proteins that your body uses to repair damage. And so what they've done is they've extracted these from, really what is the closest things we can get to stem cells that are in use today, that make these, they're, like I said, they're like little paramedics that arrive on scene and do the repair work,
Yeah.
So that's what a stem cell really is.
I see the size of this bottle right here. I'm wondering, does it also come in a vat? Like, I could just dump myself in it. Yeah, just swim in it. Hey, by the way, this month there is a special for Great Day viewers. Botox for just $11 per unit. And Great Day viewers get 10% off all treatments. For more information on any of the full range of beauty and anti-aging services available at the Institute of Anti-Aging, you can call them at 713-807-1000, 713-807-1000, or go to their website, antiageinstitute.com. Patty, have a great time. Au revoir, and merci beaucoup. When our next guest went to the doctor.